One of the things I learned very early on, that there was no way that you could create a great patient experience if you did not simultaneously focus on creating a great place where doctors want to practice medicine and where doctors and nurses can work well together. Most of us in here were not taught to step back from doing it all the time and ask, how are we doing it? Could we do it better? And my goal is to help you all get improved outcomes for your patients and also for yourselves. Tom Peters, author of In Search of Excellence and Thriving on Chaos, said, if the other guy's getting better, you better be getting better faster than that other guy's getting better, you're getting worse. All of the quality metrics that are currently being judged are now being judged on the basis of percentile, not on the basis of percentage. You are being compared, and it's about percentile, and you are going to be paid and judged on the basis of percentile. Why is this important? Declining reimbursement, workforce shortage, malpractice risk, transparency of data, pay for performance, and the fact that quality and service are inseparable. We're also in a situation where pay for performance for hospitals is here right now. And the only way that the hospital gets money back, this is a simplification, if it's at the 50th percentile or shows improvement over the previous reporting period. Guess what's coming our way? Pay for performance for physicians. And in the same way that our hospitals are having money withheld, and they report core measures, and they report HCAHPS, we're going to have to report our quality metrics. And our payment will be tied to quality and cost metrics. And what's going to happen is they are going to create for us a quality of care composite score and a cost composite score, and that will lead to what's called a physician value-based payment modifier. So the old paradigm of I give care, I get paid is going away. And in fact, what's coming is outcome equals income, and that has to do with exceptional clinical quality and extraordinary patient experience. And if we do both of those things, we will do very well, and if we don't, we won't. I'm going to make a bold statement here. I'm going to tell you patient satisfaction is irrelevant. Why? Because it's not enough. We have to create memorable experiences for our patients, astonish them, and differentiate ourselves, because to satisfy is to meet an obligation. But here's the problem. We all think we give great service. We think our patients love us. We think staff love working with us. The lay press will come, Wall Street Journal comes along. It says doctors need to work on their people skills. Doctors don't listen. Doctors have no time. What does this mean for us? It means there's a lot of work to do. It means we have to get everybody on board. It means everybody on board. You can't get quality as a group. A chain is only as strong as its weakest link. And I say, with the measurement feedback you get, and we should ask for it, and we need to inculcate in our colleagues that if they're not where they need to be, they should ask for help. It's not a matter of perfection. None of us are perfect, but it's a matter of taking the feedback rather than being defensive about it and taking it as an educational opportunity to get better. Because it turns out that a great patient experience is not about our intent, it's about our patient's perception. I want to give you 4 strategies to improve the patient experience. The first is think bakery, the second is think baseball, the third is rounding on patients, and the fourth is follow-up phone calls. The first, think bakery. When you first walk into a bakery, what's the first thing you notice? Smell. If you work in the bakery, do you notice the smell? No, you get used to it, right? So when people first walk into your hospital, what they see and what they feel and what they hear is different from what you and I see, feel, and hear, because we're bakery workers. We're used to our environment, and they're not. And we have to recognize if it truly is about their perception, what they see and what they feel and what they hear is different from what you and I see, feel, and hear. We can almost hit a home run, but be called out if we don't touch all the bases. And the challenge is, how do you remember all the bases to touch? And that's where in the Studer Group we talk about AIDIT. Acknowledge, introduce, duration, explanation, and thank you. Is what do nurses want from us? I like acronyms. They want CARE. They want collaboration, appreciation, respect, and education. And I think if we can walk up to the nurse, whether it be, in the pre-op setting or otherwise, and say, is there anything you want to tell me about the patient? Do you have any questions about his or her illness or anything that I can teach you? And do you have time to round with me? I think it will save you time, and I think it really gives the patients a sense of team. And strategy number 4 is follow-up phone calls. How do we improve our colleague experience? How do we get our docs on board? And I want to talk with you first a little bit about creating the sense of team, and then I want to talk with you about your role as leaders and what are the steps that we need to take as leaders. The role of leader, really, from my perspective, is to define the vision and get everybody on board. The role of manager is to help create a great practice environment, that is, to fix the systems. The role of team player is to engage your staff and providers and really have it be a team. That's very hard if you have some people who are a team and some people who are not. And then the last is to ensure consistent clinical quality and compassion, and that's the role of healer. When we want to talk about getting people on board, the question is, how do you translate whatever your standards were? This is one of the hospitals I work with at Hawaii Pacific Health, and this is their physician promise. How do you then translate that into actionable behaviors? And that's where it comes to the things that we've talked about, and the high-performing physician self-test. You have taken on the role of being a chief and being a director of a service that makes a difference in people's lives every day. So not only are you doing that for your patients, but you're trying to help your colleagues do that for a whole lot more. And your organization, committed to excellence as it is, has a huge footprint. And I think will have an even greater footprint as we go forward.